in our daily practice, we see majority of our patients have, there's mainly two main complaints they come with. Either it's knee pain or it is back pain. So majority of the patients who come to us with knee pain don't have any history of trauma or fall or any accident. They just come with knee pain and multiple joint pains. So the causes for it, this are like I mentioned, any vitamin D deficiency, which is due to decreased exposure to sunlight or due to decreased intake of food, like which has less content of calcium, like milk and egg white. This causes vitamin D deficiency. Vitamin D is majorly responsible for the bone to get its strength. Bone strength comes from vitamin D. So this is one of the reasons for knee pain. And then there are other reasons for knee pain. We call it as arthritis. So the usual arthritis which you see post 60 years of age, we usually call it as degenerative arthritis. But the arthritis which you see in young age group or middle-aged age group, around 20 to 40 years, is either due to an increase in serum uric acid, we call it as, which leads to gout. If not, this other disease called rheumatoid arthritis. So a rheumatoid arthritis patient usually is in the age group of 40 years, and it's usually in females. Majority of our 80% of our patients are females. So these patients have multiple joint pains, usually in the digits, like the small fingers and in the wrist. The main complaint is in the wrist and in the fingers, and with swelling they will have. There's something called as early morning stiffness. So these people, when they get up in the early morning, they have a lot of pain and stiffness. This is more common in rheumatoid age group, rheumatoid people. And the serum uric acid, like I said, the gout is a disease where the serum uric acid is increased. So this is a chemical that is produced in the body, which is called as uric acid, which is increased in certain people. It might be hereditary, it might be autoimmune also. So this is the reason why they have multiple joint pains. If the patient has come following any fall or trauma, then there's a varied line of treatment. Initially, we get an X-ray done. We see if there is any injury to the bones. With the X-rays, you get to know if there is any injury to the bone. That is the main thing you get with an X-ray. But clinically, when you see a patient, you get to know that this patient doesn't have any fractures as such. So the X-rays will be inconclusive. So we advise a patient to get a CT scan or an MRI. Usually, a CT scan is done to rule out any fractures, any small minute fractures which are missed on the X-ray. And an MRI is done usually to see our soft tissues, like soft tissues meaning our ligaments, our tendons, our menisci, whatever is there surrounding the knee joint. So we usually get an MRI done, and an MRI gives a clear picture of the knee joint regarding its ligament, regarding its menisci, regarding its soft tissues. Depending on the treatment now, it's a varied thing. Depends on the MRI. We see the MRI, depending on what is the injury in the MRI. Does it need a reconstruction? Does it need any plastering, conservative management? Also can be done. That depends on the grade of injury, which can be seen only with the MRI, and clinically what is there for the patient. So this is the first group. The second group, like I said, the gout patients, who have increased uric acid. So initially, when these patients come, a thorough clinical examination and also history asking for the patient. Usually these patients come, like I said, with early morning stiffness. They will have a strong family history of arthritis. And these patients usually come with multiple joint pains, not in just one joint, multiple joints. And also they have swelling in those joints. So you get a clear history from the patient, then send for the blood test for the patient. If you are suspecting rheumatoid, we do a rheumatoid test. If you're suspecting gout, you do a serum uric acid. And the normal levels for uric acid is 2.5 to 6.5. And the above borderline is 6.5. Anything more than that, we start on drugs for the uric acid to get the uric acid down. Tell the patient to avoid intake of alcohol, smoking, and also non-veg and fish. All these kind of food items have more of uric acid. So we reduce that. And rheumatoid, like I said, rheumatoid test, we get it done. But this is a very basic test. So this doesn't give a clear picture. So we do something called as anti-CCP test, so which gives a more better picture. So this is the second category. Now the third category is our old age group. So the old age people who come with knee joint pain, because this is because of their wear and tear. This is a majority of the patients who come to us with knee pain in the old age is after 60 itself. This is our knee joint. So the knee joint you keep using the knee joint. with age, with the time, the knee joint is covered by something called as cartilage and menisci that starts wearing out. The knee joint starts wearing out, because of which we whatever supporting structures are there that are damaged. So this happens with age. So we call it as degeneration happens of this menisci and cartilage. We get an X-ray for these patients. We initially get an X-ray. We see what is the grade of injury, how bad is the injury. If it is, there are varies. So initially we grade it. If it's a very small grade, mild, we call it as mild, moderate, severe. So in mild, we can treat with conservative management, ask the patient to not to sit cross-legged, not to sit down on the ground. And in moderate age group, we have newer techniques that has come now. We give a injection, intra-articular injection, we call it, to reduce the pain. And also that forms a barrier. Whatever we give the injection intra-articular, we give it into the knee joint. So this forms a barrier in this knee joint and prevents it from getting degenerated. It avoids it getting degenerated, but this is not a permanent solution. So we have multiple. Now there's a new technique called as platelet-rich plasma, PRP we call it as. So we can give a PRP injection to the knee joint. This avoids it from getting degenerated, but this is not permanent solution, is not this. Then, like I said, severe. So in severe, patients come with fully degenerated knee, they'll have a deformity. Their legs will be either bowed inside or outside. For these patients, we advise operative management, that is knee replacements. This kind of exercises I recommend to only people who have any old age related degenerative changes or who have knee pain without any fall or trauma. So for these patients, we call it as quadriceps exercises. So what we do is we make the patient lie down and then we ask the patient to press his kneecap down so that the kneecap is attached by quadriceps. We call it as a muscle called as quadriceps. So we strengthen the quadriceps. So because of this strengthening of the quadriceps, the knee pain reduces. And also you can always do a knee bending and extending exercises. Bend the knee and extend the knee along with the quadriceps exercises. Push the knee down, that is one is quadriceps, and the other one is lift your leg, lower it there for some time. And these exercises you should do every day, at least 10 minutes in the morning and evening. 10 minutes of your time you devote it in the morning and then evenings should be good enough. Majority of our patients, which we see in young age group, they come with very low vitamin D. So vitamin D is required for your bones to be strong and also the covering of the bones, which is called as cartilage. That also gets its strength from vitamin D. So make sure you have adequate sun exposure. Sun exposure, especially in the early morning, 6 to 9 o'clock. So 6 to 9 o'clock, go out in the sun daily, have a brisk walk, 30 minutes, 40 minutes, how much ever you're comfortable, have a walk. This increases the vitamin D content. And also, if it is not increasing, you always have supplements to increase your vitamin D. This is to all the IT professionals who are more prone to work inside only, work from home. All this concept has now started. So please go out, have a walk, half an hour, 40 minutes, 1 hour in early morning. 6 to 9 o'clock is the best time to get your adequate dose of vitamin D. Now, the second, like I said, the degenerative changes, how do you avoid? Main thing, India is more prone to knee joint pains rather than in the foreign countries, we are more of hip pains because their activities is like that. In India, we have knee pain. And why is that? Because our Indians are used to sitting cross-legged and sitting on the ground. So whenever you cook, whenever you eat any meals, we have been doing that for the past 40 years of our life. We've been doing that and we are accustomed to it. So because of that, there's a lot of wear and tear that happens in the knee joint. So I would advise everyone to don't sit down, don't sit cross-legged and do activities. And also the other thing is reduction of weight. All your weight falls on the knee joint. So there's something called as BMI. So every height should have this much weight. That is what is prescribed, or around that, plus or minus 5 is okay for that. But people come with 5 feet, 5.1 feet, and they are like 90 kgs, and they will have very early knee pain because all your weight falls on the knee joints. There's only 2 knee joints which will fall so the body has to take all the weight. The knee joint has to take all the body weight. And because of that, you will start having knee pain. So please make sure that you do not become overweight or obese. Even if you are, please do a regular activity, and don't have a sedentary lifestyle. Start doing exercises regularly, reduce your weight, and the knee pain will automatically come down on its own. There are a lot of things people say and all. See, the first and foremost thing is, don't go for oily food. Don't go for fried items. Okay. I am a strong advocate of avoiding red meat because that increases your body weight. So avoid red meat, basically mutton and beef. And fish is good. Fish has a lot of calcium, so that is good. Chicken once a week, maybe twice a week is okay. And when it comes to vegetables, green leafy vegetables, anything that is green leafy vegetables is good. Spinach, beans, your cauliflower, your lady's finger, everything is good. Anything green leafy vegetables which has a good content of pulses and calcium are very good. Okay, and now apart from that, milk, which is a good quantity of calcium, and egg white, not the egg yellow part, the egg white part, which is a good quantity of calcium and vitamin D. Along with that, the good amount of sun exposure is a must.